that is organized by the Cross-Border Threat Screening and Supply Chain Defense, CBTS Center of Excellence by the Department of Homeland Security here at Texas A&M. So we're honored to have Dr. Bethany DeSalvo, that is going to be presenting the Census Bureau's Community Resilience Estimates as a metric of community risk for COVID-19, social, economic, and housing statistics division from the United States Census Bureau. I would like to introduce Dr. DeSalvo before we start with her presentation. Dr. Bethany DeSalvo has been with the United States Census Bureau for over 10 years. Currently, she is the branch chief of Small Area Modeling and Development in the Social, Economic, and Housing Statistics Division. Her branch is responsible for the research, development, and application of small area estimation techniques to provide data users with finer detailed data that can be provided by direct survey estimates. Her area of research also includes exploring, developing, and extending the use of small area estimation methods to new content areas. Previously, Dr. DeSalvo worked for the Federal Statistical Research Data Center, where she worked closely with academic researchers to utilize federal data to answer complex problems. Dr. DeSalvo is also a member of the U.S.-Mexico Task Force. That is one of the projects that is hosted at CBTS, where I'm the PI. I'm Dr. Medina Cetina. And we know that no one is prophet in their own land, but I think Bethany is the exception. So welcome home, Bethany, because Bethany is a PhD from Texas A&M University in the sociology in demography. So she received several Department of Commerce bronze medals for her work. Her most recent work on the community resilience estimate is being used by several federal agencies in the response to COVID-19. So we couldn't be prouder and really honored to have Bethany presenting for CBTS. So welcome home, Bethany, and we're ready for your presentation.
Thank you very much. Thank you for having me. It's an honor to be here. You all are welcome to interrupt me with questions if you have them. I believe there will be time at the end as well if you prefer to wait. So feel free to just jump in if you have questions. I got to see the list of registrants before I came in, and we have really a broad group of folks, and so feel free to jump in with any questions that you have if you want me to go in a different direction. But I'll go ahead and start. So the community resilience estimates are new to the Census Bureau's portfolio. We released them in July, actually in June. And it was, right in March of last year when we realized that, we were headed towards a pandemic. And the question became, what can the Census Bureau do to really contribute to information that will be needed over the future, and then leading throughout the entire life cycle of this disaster. So we're working with several federal agencies, and I'll kind of walk through what we're doing currently, and then where we hope we're going. But this team it's a small team for the Census Bureau, but an incredibly talented team. So we work with Wes Basil, who's the technical team lead, Sam Slepka, who I believe has joined or is joining the call in case there's some statistical questions that y'all have. Gabe Amaro, who's also a Texas A&M grad, and Chase Sawyer, who's from the American Community Survey Office. So we have a nice group of folks that have helped us, but this is not an established program at the Census Bureau. It's a new endeavor, and I'll talk a little bit more about what that might mean for the future. So the first question you may have is, what is resilience, or what do I mean by resilience? So lots of academic fields talk about resilience, from physics and sociology to economics and urban planning. So the definition that we use is that it's a measure of the capacity of individuals and households within a community to absorb, endure, and recover from the external stresses of the impacts of a disaster. So research shows that resilience can be predicted by individual and household characteristics, at this point, this research is mostly theoretical. Part of our plan, our team's plan, is to really test that and to create a research infrastructure, working with academics and working with our federal partners to really test, can resilience actually be predicted by individual household characteristics? A lot of academic research so far, both quantitative and qualitative, really shows that probably, but hopefully some at least quasi-experimental studies are in our future to really test that idea. So the Census Bureau has something called experimental estimates. If you Google census and experimental estimates, you'll find 5 or 10 different products. And basically, so for the Census Bureau to release an official estimate, there has to be a law that tells us, this particular tabulation of data or this particular product needs to be created for this law. So that's the mandate of the Census Bureau. But because many of us have our own research questions and really, want to help society move forward, we are often allowed to create new tools and put them in the experimental data series. And so what we do is we post the data, and in this location, all the data meets census statistical standards and are well documented. And then we ask the public for comments. And so that's where we're at now. So we've released the beta product. In the next few weeks, hopefully you'll see another product come up. I'm unable to show that here because we haven't released the data yet. And then, so if you guys have comments, whether you want to give them in this presentation or shoot me an email after, they would be greatly appreciated because we're actively engaged in the customer service portion of this work. So part of that is we're trying to build a longer term program where the Census Bureau is actively engaged in disaster research. So I'll talk a little bit more about that in a few minutes, but we would like to invite our academic partners and our federal partners to join us both in paper writing and statistical work, as well as just giving us guidance and direction about where to go. So so the idea was, use the theoretical research that's out there to see if we could predict which groups would be most vulnerable. And if you're in a place where there's a lot of vulnerability, then the community is less likely to be resilient. Again, this has never really been tested with data, and that's part of what we're proposing to do, truly statistically tested with that. So we built the estimates last year, and then this year when Joe Biden became president, there was an executive order, and we call this the executive order on equity. And so here's part of it. And basically the idea is when disasters occur, the vulnerable are at the greatest risk, and the vulnerable are also the hardest to count. So if you're using any data source, finding the vulnerable people, that's a hard thing, right? They're hard to count. But when we do count them, often, there's some sort of undercount. And then also we've got folks who live in small areas or in rural areas. So about 1/4 of the population, it's probably more than that, I'm being conservative with that number, is in a place where using a traditional survey estimate from the American Community Survey or any of our other surveys probably wouldn't be enough. So the sampling error is too high, the margin of error is too high. And so that's when small area modeling comes into play. It allows us to utilize statistical techniques as well as multiple data sources in order to increase the precision of the estimate. So this executive order is all about equity. And so federal agencies have all been tasked to understand how they are measuring equity and how they are getting at equity. So it's a policy, and so it's not written with a ton of specifics. But for groups like FEMA or Health and Human Services or other places who haven't necessarily had to prove this before, they're coming to the Census Bureau and saying, okay, you guys are the folks who measure these characteristics of people. We don't actually measure the lesbian, gay, bisexual, transgender, queer yet. We are working on it, but we do have folks with disabilities, racial differences, geography, poverty, and other measures of inequality. And so all of these measures are on the American Community Survey, which is, you know, the largest survey and most representative in the U.S. And so that's what we're using for these estimates. We're using the microdata. That means we're using the raw data. So if you were to use publicly available data, you kind of get tabs of, you know, this is what this group looks like, this is what this group looks like, but you can't look at all the characteristics in one file. But because we have the raw microdata, raw is an overstatement, but you know, we have restricted microdata, we're able to look at all those characteristics at the same time. And so the models are able to be a little bit more precise, or a lot more precise in some cases, than if you were using publicly available data. So there are sources, other sources of you know, vulnerable populations and things like that. The CDC has one. There's a few other groups out there, but they have to use publicly available data, and they have to stack the data, the measures on top of each other, which means that they don't have a measure of error for their composite score. And that matters a lot. As it turns out, we've replicated other measures that have used publicly available data, and we find that, you know, especially for the most vulnerable areas, that we're not sure that the differences in the estimate, or what makes them most vulnerable, isn't just sampling error. So there's a need to really get the Census Bureau, I think, in the game, and the microdata that the Census Bureau has to offer. So why should census measure resilience? Because we are the main source of characteristic data in the federal government. So all current measures of vulnerability or resiliency, or however you measure for the US population, include data from the US Census Bureau, and they all use publicly available data except for this particular measure. So like I mentioned before, the ACS restricted microdata that we use retains the correlation among the individual risks, which helps us kind of get to the score with a measure of uncertainty. So those data are not available to the public. And if you partner with the Census Bureau, whether you're a federal agency or an academic, then, you know, you could potentially access these data with us, in collaboration with us. So we're hoping to pick up some academic partners along the way. We've got a few going, several from Texas A&M actually. So the Census Bureau also has a broad data warehouse. So we're the nation's leading statistical agency, and so we have a good bit of administrative record data that could potentially be useful. Right now, we have the Social Security Administration's Numident file, which is like the death claim data. Also Medicare administrative records, SNAP administrative records. We've got some IRS records, and, you know, all of these things come with memorandums of understanding and lots of agreements and promises and protocols. So I'm not trying to act like it's an easy thing to get access to. But I think, you know, being able to use multiple data sources really enables us to kind of answer some questions, both in the research field and then also, you know, enhancing our precision of our estimates as we integrate these things. So the use of small area modeling, so half of the branch that I work in, Sam included, who's on the call, are mathematicians who are experts in small area modeling. They have many years of experience with several of the Census Bureau's long-standing small area products. And so they work closely with subject matter folks, is how we say it, to try to integrate multiple data sources and come up with small area estimates. And depending on if you're, you know, how much you know about federal data, we're all kind of in this game of, you know, understanding disclosure avoidance. And what that means is, you know, protecting privacy. So as there's more and more data released, both from the federal government and other sources, there's this, you know, fear that people could kind of triangulate the data and have more creative and interesting ways to overcome privacy protocols. And so there's a lot of work that we must do in order to protect the data. unlawful disclosure. And so some of the smaller modeling techniques that we use allow us to release data with confidence that we're able to protect the privacy of the respondents. It also means, so if, running an estimate like this on survey data alone we wouldn't be able to get that out of the door because of differential privacy issues. So I'm happy to talk more about that with anybody who's interested, because people who are interested are like very interested, and then people who are not don't want to hear any more about it. So feel free to ping me if you want to talk more about that. And then because the Census Bureau has really strong partners with the academic community, we're hoping that we'll be able to jump off of that. I'll talk more about that in a few minutes, in a few seconds. So basically, for the beta model, so again, there's going to be another model that's coming out in the next few weeks, I hope. But right now I'll describe what the beta model looks like. So it's the ACS restricted microdata and publicly available tabs from the National Health Interview Survey, or NHIS. They're used to estimate community resilience to disasters at the individual level, then combined with auxiliary data. So for us, that's the population estimates data. So it's by tract, age group, race, ethnicity, and sex. And I think actually we also have region in there. And then the risk flags. So, what makes somebody at risk? There's 11 possible risks. We designed this in June, so they're really reflective of what we knew in June. And right now we're testing some additional risks to see if they enhance the model at all. But basically the flags are cumulative, so any individual can have up to 11 risk categories, and then the individuals are grouped by their number of risk factors. Here's the risk factors that we used for this model. So anyone aged about 65 and above would get a flag. We've got an income to poverty ratio less than 130. That's a pretty conservative. All of these measures are pretty conservative, actually. Folks who are living in single or zero caregiver households, so a single parent with a child at home, or a person over age 65 living by themselves. Just two examples. Those living in households with a communication barrier, defined both as no one in the house having a high school education and no one in the house speaking English very well. Those who live in a household with no employed persons, and these estimates are based off 2018 data, so you can imagine that it's more of a conservative estimate because there's a lot more unemployed persons than there used to be. But actually, that we don't have those data yet, haven't been given to us because it really was only a year ago, and it takes just about a year lag to be able to have access to the data. We also have folks with physical or mental disability or serious constraint to significant life activity. We've been asked to flag in the next model, we'll be flagging anyone with disability defined in the ACS. So again, if you're really interested in any of these characteristics, feel free. I mean, you can ask me questions now, but also feel free to email me and kind of, we can hash it out and you can give advice if you like. We have some measures of crowding as well, because that was something folks were really talking about in June, and anybody living in group quarters, as well as other measures of density. So for the National Health Interview Survey, we flagged rates for respiratory disease, heart disease, and diabetes. So all of that results in a tract level estimate for the number of individuals by the number of risk factors they are living with, categorized into 3 groups. So 0 flagged risk factors, 1 to 2 risk factors is kind of the medium group, and those with 3 or more risk factors. We consider those the most vulnerable. We also have a flag for tracts. So tracts are about 4,000 people. If they're more than 30% of the population is flagged with 3 or more risk factors, we flag the tract. So you can look at like high risk tracts. So we have an ESRI tool. This isn't live. This is just a screenshot. I found that like Teams just falls apart when I try to show this live. But basically, this is a tool hosted at the Census Bureau in collaboration with ESRI. ESRI created this, and you can go down to the tract level for each geography in the U.S. And so, you can spend a good amount of time playing with this. But the basic idea is, what's the total population? What, who is flagged? How many people are flagged? And then what geographies are flagged? So, so as part of this, we have been asked by FEMA and Health and Human Services if we they keep, asking us for some custom geographies and some local area information because they're using our estimates as part of their models for vaccine distribution. They're also using it for this equity executive order that I talked about. So the first place that they wanted to know about was Western Pennsylvania, and I'm from Western Pennsylvania, so that it was kind of fun to really dig down and to think about it. And so this is what the counties look like. And so, the red counties would be the 30% and above. And so those would be most high risk. And then, you can see this is the tract level data. So, a county might be considered high risk, but then you can really see the clusters of areas where, there's more folks who are considered high risk. Again, this is the southwestern area of Pennsylvania. And so we quickly kind of created some for Brazos County for you all to see. So sorry that the colors changed on this one, but what you see again is, the county and then the risk level. And we'll go down a little bit further. So this is Brian, and I'll let you, if anyone has a question, feel free to ask here, and I'll leave this up for a second so your eyes can get acquainted, and you can adjust. But you can see Texas Avenue there, and I lived